Please seated.
Hereby, I open this academic ceremony in which Nivine Hanach will defend the academic thesis Postpartum Depression in the UAE, Insights, Challenges, and Pathways to Support. May I invite you to present a summary of your studies and the conclusions of your thesis.
Dear Prorector, dear members of the Assessment Committee, dear supervisors, family, and friends, in the next 15 minutes, I will present the summary of my thesis and the main findings on postpartum depression in the United Arab Emirates. Can we imagine how hopeful and joyful it is to bring a life into the world? But can we also imagine how for many mothers this comes with profound challenges as they navigate a roller coaster of emotions and changes that it might feel overwhelming and isolating. The postpartum period, one of the most significant transitions in every woman's life. It is during this time that the mother has to adapt to a new role while managing immense psychological, physical, and social changes. It is also during this time that the mother, unfortunately, is highly vulnerable to mental health problems. Postpartum depression, one of the most common forms of depression, affecting 1 in 7 women within the first year after childbirth. Postpartum depression is characterized by persistent feelings of sadness, of low mood, irritability, inability to enjoy things, inability to bond with the baby, changes in appetite, sleep disturbances, and many more. Postpartum depression, if left untreated or even unrecognized, can persist for years, leading to detrimental effects not only on the mother, but also on her infant, on the mother-infant bonding, on the overall family dynamics, and as well as on a national economics level. Now, when we speak about postpartum depression in the United Arab Emirates, little can be found, and this can be due to multi-level challenges within the mental health infrastructure of the country, as highlighted by the national policy for the promotion of mental health. So, for example, at the structural and policy level, there's limited funding for mental health resources and services, but also there's limited research landscape, particularly among vulnerable populations. At institutional level, there's a poor coordination between different healthcare authorities across different emirates of the UAE. At a community level, there is a huge public stigma on mental health. At interpersonal level, there's a knowledge gap on mental health problems. And one of the main challenges at individual level is the large expatriate population, which constitute 90% of the UAE population, which is also accompanied with increased mental health needs, and as well as due to lower social support system, but also which could pose additional challenges on the national mental health care system. So this, in fact, has been the motivation behind our research, to fill the existing evidence gap on postpartum depression and try to establish a comprehensive understanding on the situation, but also to suggest potential innovative solutions to address the problem. So as a starting point, we conducted a prospective study to evaluate the prevalence of postpartum depression and the associated risk factors. We collected data from mothers at 3 time points of the postpartum period, immediately after childbirth, at 3-month and at 6-month postpartum. And we found that 35% of the mothers exhibited severe depressive symptomatology during the first 6 months postpartum. We have also identified several risk factors. Mothers who are aging less than 25 years old, who are receiving financial support from their family, who are having difficulty in managing their monthly income, who had a part-time employment, had a higher likelihood for developing depressive symptoms. Whereas those whose husband was employed, who were receiving sufficient husband support, and who were living in their own house were less likely to develop depressive symptoms. Now, when we further stratified the analysis into different stages of the postpartum period, we found a temporal variation in these risk factors, but also along with emerging new risk factors. So, for example, mothers who had a maternity leave more than 3 months were more likely to have a higher risk for postpartum depression in the first 3 months postpartum. But from 3 to 6 months postpartum, mothers who were of a Muslim religion had the higher risk during this time, but those who perceived their infant as healthy and who were breastfeeding their infant or had a history of breastfeeding other children had a lower risk for postpartum depression. So these findings imply the importance of actually following up on postpartum depression during different stages of the postpartum period rather than only focusing on the initial phase. Moving on, as we were conducting our research, the COVID-19 pandemic has started. And we all know that during global health crises, there's an increase in mental health problems. And this is specifically important among postpartum women as the uncertainty and the stress of such a pandemic can add further challenge and exacerbate their state. So we conducted a cross-sectional study to evaluate the prevalence for postpartum depression during this period of time, but to also look if there's any emerging new risk factor, any changes in risk factors, but also if there's any new COVID-related factors. And we found that nearly half of the mothers who completed the online anonymous survey were exhibiting severe depressive symptoms. And those who had a history of depression and who have faced some complications during childbirth had a higher risk for postpartum depression, whereas those who were receiving sufficient husband support and who were breastfeeding their infant had a lower risk for postpartum depression. Now, in terms of COVID-19 related factors, mothers whose work status was negatively impacted or who were having difficulty in managing their weight had a higher risk for postpartum depression, whereas those who were regularly exercising and who sought a medical advice through virtual consultation with a healthcare provider in the UAE had a lower risk for developing depressive symptoms. Fortunately, despite the mental health challenges in the mental health care system, the healthcare sector in the UAE remain one of the most developed in the country, but also in the region, with a strong emphasis on digital health solutions. And we have witnessed over the past decade the increased adoption in telemedicine services. So this is when we thought, what about these telemedicine services could be like a potential tool to bridge the gap in mental health care for new mothers and prevent postpartum depression? This is when we conducted a systematic review and meta-analysis to evaluate these telemedicine services and their effectiveness in mitigating postpartum depression symptoms. The interventions varied between telephone-based and web-based, but there was also some kind of differences in the content of the intervention, some of which offering cognitive behavioral therapy, psychoeducation, behavioral activation, peer support, or even just regular coaching sessions. And this have also been associated with differences in the intervention providers. Despite that, irrespective of the type of the intervention, we found a significant decrease in postpartum depression symptoms among the mothers who received telemedicine services in comparison with those who received the usual care or no intervention at all. Now, building upon previous chapters and to add a layer of depth to our research, we aim to further explore the mother lived experiences in the UAE and their perception of the overall available social support resources, and as well as their perception of the overall postpartum period. So we did that through a multi-purpose exploratory focus group study. It's important to note that at the time of the focus group discussion, 16 out of 27 women, they exhibited severe depressive symptoms. Now, in the first part, where we focused more about the perceived mental health needs and their perception on the overall available resources, we found some kind of differences between primiparous and multiparous mothers. However, when it comes to their emotional experience, the majority of the mothers exhibited similar emotional experience, irrespective of the parity, with specifically describing the first initial period of the postpartum period with negative emotions. Now, one of the main challenges that has been frequently mentioned in every focus group discussion was breastfeeding, especially among the mothers who were having difficulties with breastfeeding, where they described that it was emotionally and physically exhausting. And this is particularly because they were having some kind of difficulties in accessing support, whether formally with a lactation consultant or for having support from their environment. Several factors have also been identified to influence the mother's postpartum mental health in the UAE, but one of the most frequently mentioned one is the lack of mental health support, specifically from healthcare providers and as well as from immediate family members. Other factors included societal and personal expectations, work-life balance, and sudden life events with other immediate family members. Despite all of this, the mother actually valued several social support resources, and they appreciated the instrumental support they received from their own mothers and from the nanny, but also the emotional support specifically from the husband. They have also articulated the need for both formal and informal resources to support their mental health, and this included to having more attention to mental health during the postpartum visit. So the visit will be more beyond physical examination, specifically with the gynecologist, and to speak more about their mental health after childbirth, to have access to a specialized psychotherapist. And interestingly, the expatriates specifically, they mentioned their need for having peer support and community network to have some sense of belonging and community in the UAE. And finally, the mother actually needed to have some alone time to recharge and cope with the stressors of the postpartum period. Moving on to the second part of the focus group study, where, because we believe the importance of the community of interest and taking their perspective into consideration before we start thinking about designing and implementing any digital intervention, we sought to look into their usage patterns in terms of digital resources, but also their needs for these digital resources. And we found that the mother extensively used various forms of digital resources after childbirth, primarily for two reasons. The first one is to seek information about parenting and infant health, where they either did like a simple Google search or sought information through social media platforms, or they looked into government-led platform from back their home country. And the other reason is to seek validation and emotional support through online communities, where they joined Facebook groups stratified by specific interests, for example, Australian women in the UAE, just to have some kind of sense of belonging, and as well as through participating in discussion forums and parenting mobile apps. But they have also faced several challenges with these digital resources despite their extensive use of them, and expressed several needs. The first one is to have a governmental-led digital platform, because they were very much challenged with the fact that there are so much spread of misinformation, and they thought that a government-led digital platform led by experts could actually help them know that the information is trustworthy, and they emphasized on the need to have mental health educational resources to know when to seek professional support. The second need was to have a tailored postpartum virtual care, to have access to a healthcare provider that they know that would support them during the postpartum period. And they specifically mentioned the need to have access to a lactation consultant, but also specialized psychotherapist. Now, despite the fact that many mothers already use peer support online groups, they actually emphasize on the need to have these peer support groups to be controlled by an expert, to control the spread of unsolicited advice in these groups, but also to control the sense of competition that might occur between mothers. Finally, our research represents a foundational step towards enhancing our understanding on postpartum depression in the UAE, and it provides several recommendations for future direction. The first one is it emphasizes on collaborative efforts through integrated maternity care and interdisciplinary cross-organizational approach. To researchers to adopt inclusive research methodology in order to reflect the heterogeneous nature of the UAE population. To develop structured mental health programs in order to increase the mental health literacy and as well as to reduce the mental health stigma. The fourth point is to train healthcare providers in identifying postpartum mental health problems, but also in providing culturally competent care. And finally, for policymakers, to allocate sufficient fund for resources, services, and as well as awareness campaign, but also screening protocols for postpartum mental health. Allow me to conclude this presentation by saying, yes, it takes a village to raise a child, but it also takes a village to raise a mother to raise a child. Thank you very much for your attention, and I give back the word to the prorector.
Thank you very much for your very clear presentation. We will now start with the opposition, and the opposition will be opened by the chair of the assessment committee, Professor Krutze, Professor of Behavior Change and Technology at Maastricht University.
Thank you very much. Well, dear candidates, my compliments on your work. I think are highly relevant, both in terms of practical relevance, but also gaining insight in data in specifically the Arab region. And I know that quite some work has been done during COVID-19, which I can imagine was challenging, but you made a research question out of it, so that's, well, very well done. You also managed to publish a lot in your thesis and also outside the work in your thesis. I also read you do a podcast even to fight the misinformation, so very lot. I think you're a great proof of the potential in the region, and I think one of the many talents from Lebanon we've seen here in Maastricht, so welcome to the club. I want to start with a question, which I think is a very simple question, but then I fear the answer is complicated. So already in the introduction, you talk about the Middle East and you talk about the high prevalence of postpartum depression. I think it's 27%. So the first question, very simple, why? Why is this the case, you think?
Highly esteemed opponent, thank you very much for your kind words and for your question. Honestly, this was actually the first question that I asked myself, that why? Why? I think first it would be due to the limited also research landscape on postpartum mental health, the fact that there are so much of discrepancy in reporting the postpartum depression, I mean. But I also believe that, so the first point is to say that there is still insufficient data to actually prove, like, is it really that high or not? But the second reason that it actually would be why it's high could be due to less focus on postpartum mental health or in general, because there is no emphasis on the problem in our region, and it's usually could be due to our culture, that when it comes to the expectations of the mother's role in the postpartum period, so anything that she would be going on that it's not given much attention. So this would end up like with the mother not seeking help perhaps, and thus leading her to developing higher in comparison to other perhaps countries.
Yeah. So I think on the one hand you're saying, talking about cultural differences and how this affects health-seeking behavior. On the other hand is the more the research part, or the lack of research, let's call it like that. And I think that's also a nice bridge to my the question following up on that. Because if I look at chapter 2, you use the Edinburgh postnatal depression scale. What do you know about this scale in the sense of to what extent is that appropriate in this region and so on?
So EPDS, the Edinburgh Postnatal Depression Scale, has been already validated in different cultural content, like more than 50, like it's a very culturally sensitive scale, and it has already been validated specifically in the UAE, and it has shown like over the course of many research studies that it has a high specificity and high sensitivity in actually detecting the increased risk for mothers for postpartum depression. At the end of the day, it's a screening tool. Yes.
And do you have any like anecdotal evidence of women completing these scales? Like any anecdotal evidence on like how they reacted to, if you look at the items that are there?
To my knowledge, I don't have, but honestly, this is something that we are looking forward to further investigate in the future to see how the mothers perhaps interact with the scale. Yeah,
because it just based on like face validity, you would say these items, they are as applicable, they adequately reflect also cultural differences and so on.
They do, yes.
Okay, that's good to hear. Then my second question is, again, a simple why question. In chapter 4, you also just briefly presented the results, but it seems like the starting point was already focusing on technology. Well, you just heard in my chair the title, technology is in the title, so I'm not against that. But maybe one step back, why this immediately jump towards technology?
So you mean, why did we start thinking immediately with the technology?
Yeah, why not just interventions at large that could be applicable in the region?
Yeah, that's actually a very good question, because at the beginning, when we first started the research, it actually wasn't about technology at all. Yeah. But then when we looked at the potentials in the UAE, like one of the main potentials and the opportunities that we have to address the problem is the adoption of technology-based intervention. And this is, so we were thinking more on the long term, like how can this scale up and how can this be applicable, practically speaking. So, and we also looked at the evidence, and we saw that perhaps technology-based intervention could be a way to overcome the barriers, specifically when it comes to public stigma related to mental health problems, and as well as the fact that one of the main challenges that we have in the UAE is the distribution of mental health services, which is not balanced, like the geographical distribution of mental health services. So this could be potentially a way also to overcome such a barrier, and also the stressors that the mother could be going through during the postpartum period. Because I know that UAE always supports technology-based intervention, and we've looked into the evidence that it could be potentially a promising tool in addressing the problem.
All right, and I think you already in your answer, you make the link to adoption and I think even implementation to address certain barriers. And I think that brings me also to the results of chapter 6, which you also just briefly mentioned. And I think there you generated basically 2 teams on the data. And if I summarize them, and of course I'm big black and white, but I would say they are almost conflicting teams. Because on the one hand, they say like, okay, for those who have experience with digital resources, they say there's an abundance of information. Mm-hmm. There is so much out there. And the other hand, the second team is we need more.
Exactly.
So that seems to be almost conflicting. So, but then thinking ahead in the long term, what would that mean for adoption and implementation of such researches? How would you envision that to happen in practice?
Specifically in terms of the provision of information, you mean?
Yeah, because you say, like, okay, you imagine, based on this research, you developed the great technological tool, but then at the same time, they're saying there's so much already out there. So how do you...
So one of the things that the mothers, they mentioned when it comes to the abundance of information was specifically related to infant health and to parenting in general, that they found that it's already available there. But what they thought that we actually need further, specifically when it comes to the technology-based intervention, is to have more mental health-related resources, to learn more when it comes to coping mechanisms with postpartum mental health. So I would say that the technology, when it comes to implementation of any intervention, to be focused on that, like specifically on postpartum mental health, but along with, if we are saying to have access to other healthcare providers, that could perhaps support them with other aspects related to infant health and parenting.
Yeah. So there is, like the technology is a means to an end, but there is actually the need is also a different kind of information and support and so on.
100%. There is technology itself, like to overcome all of these problems. I wouldn't say it would be enough. We still need to work also on exploring the different elements that we would love to incorporate within this intervention.
All right, thank you very much. And my time is up, so I give the word back to the prorector.
Thank you very much, Professor Krutze. The opposition will be continued by Professor Sadiq, who's present online. She's Director of the Center of Excellence for Public Health at the University of Sharjah in the UAE. Professor Sadiq, the floor is yours.
Thank you very much. And thank you very much also to the candidates and the supervisors on an excellent presentation, a very interesting and much needed topic in the UAE. And your introduction definitely emphasized the importance of the need of such research. So well done. I was especially impressed with the diverse methods that you've used in your research. and taken us on this interesting journey. So thank you very much. I have a couple of questions. I think you already answered some of them in the discussion that you just had with Professor Crutzen. But my first question to you is, you discussed in the beginning the multifactorial factors that may impact on postnatal depression. And I just want you to, in the context of the United Arab Emirates and the differences that we have in cultures, the differences between expatriates and Emirati or national women, how do you think that's going to either emphasize or downplay the results of your study?
Highly esteemed opponent, thank you very much for your kind words and for your questions. So if I'm correct, the way I understood the question, so you mean that how these cultural differences could actually might have perhaps influenced the results of our findings?
Yes. So how would you explain any sort of social or cultural factors between expats, for example, and Emirati women in your research?
I think that there's quite differences when it comes to the social norms and practices between Emirati and expats. And also when we say expat, it's also very wide terminology, because at the end of the day, also expatriate, it's very diverse in the United Arab Emirates. So when it comes also, because specifically in the postpartum period, the social support of Emiratis, as we mentioned in one of our focus group studies, is quite different than expatriate women. For example, Emirati a woman would go after childbirth, they go and stay with their own mother for like 40 days, and this is something that they would expect. So in this case, it's how their mental health, perhaps they would be influenced by other factors than in comparison to expatriate who have a lower social support system. So I would say the main difference would be in the social support resources between Emiratis and as well as expatriates.
Okay, so again on that note, and again following on from Professor Crutzen's discussion on the use of the tool that you used in the prevalence study, the Edinburgh scale. Now, how would you, again, taking or keeping into consideration the expatriate population with the local population, how do you think that potential biases in the self-report would have occurred, or how did you actually address these?
This is actually a very good question, because at the end of the day, whenever it's a self-report, specifically when we speak about postpartum mental health, so perhaps mothers who are more interested or who are having some depression symptoms would have been more interested in completing the survey, so it could be associated with selection bias. Yes, I think this is one of the potential biases that could have been. But also another thing that, for instance, in the prospective study, the bias that could be associated, the fact that the mothers perhaps would know that we are following up at different stages of the postpartum period perhaps may have improved their practices, and this is the Hawthorne effect, because they know that they are going to be filling the postpartum depression scale.
Okay, thank you very much. I won't keep you too much longer, but now again, because I'm in the UAE, and you very clearly described the healthcare system and the infrastructure of the healthcare system here in the UAE and the challenges we sometimes face, especially in public health. So in a nutshell, okay, how do you think the healthcare system in the UAE can adapt to better support? Now, you have suggested online technologies, you have suggested in that last slide, all the different, you put into themes of how we can address. But in your opinion, just in a quick summary, how do you think the healthcare system can, keeping in mind again, because I'm particularly interested in the expat population, which we have a large proportion of an expat population here in the UAE in comparison to the local community.
So how can we address the problem of postpartum mental health if we're speaking on a public health level? So I think one of the first steps, because of the poor coordination, and this is also a challenge that had been mentioned by the national policy for promoting mental health in the UAE, is the poor coordination between the different healthcare authorities. And this also comes with different protocols, different healthcare system, different provision of postpartum care. So I think the first thing is to have like a unified, standardized protocol in order to address postpartum mental health in general. And this also comes with collaborative efforts with the different healthcare authorities and not to have it individualized. So when we, like every single intervention alone, so when we speak about technology intervention, if we are only addressing the problem from a technology perspective without integrating it as part of the available maternity care, then I wouldn't say it would be sufficient and enough to be addressing the problem. So it's very important that different stakeholders would work together in order to meet the needs, whether for expatriates and Emirati, but also at the same time to involve the mothers themselves when it comes to targeting the postpartum mental health, to understand their concerns and their needs for postpartum mental health. And another thing that I would say is to also, since there is some kind of differences between expatriates and Emirati in terms of perhaps their need, it's very important to support researchers to be able to further conduct a comparative study between these two groups to perhaps also see how they would navigate postpartum mental health after childbirth.
And we know that socioeconomic status will definitely play a significant role as well, because even within the UAE, we have different levels or stratified levels of socioeconomic status. And the adoption, again, following on from the first discussion, the adoption of these technologies may be challenging. And I think we really need to be aware of these before we, actually roll out some of these services. Okay, thank you so much.
Okay.
Yeah.
Thank you. Thank you very much.
Thank you.
Thank you, Professor Sadiq. The opposition will be continued by Professor Naja, also from the United Arab Emirates and present online. She is Professor of Clinical Nutrition and Dietetics at the University of Sharjah. Professor Naja.
And thank you. Thank you very much. I'd like to thank the candidate and the supervisors for this very interesting work and very clear presentation. Allow me to start by citing a few strengths that I have encountered while reading your work. First, you've been bold in tackling such a sensitive and stigma-associated topic here in the Middle East, and particularly in the UAE. That's a bold and brave stand that we salute you for. Also, your work has been very responsive to the context by tackling the COVID-19 when it arose, rather than seeing this as a challenge. I was very pleased to see that you have taken it as an opportunity to investigate further. You targeted a novel and emerging topic such as the telemedicine, and as Prof. Siddiqui has said, the mixed methods, these mixed methods that I have seen in your manuscript, cross-sectional, qualitative, intervention, systematic review, all addressed in quite a good depth and rigor. And I have to say, last point is the reading was very smooth and clear of your manuscript. So with these all in mind, I'd like to congratulate you and the supervising committee for this wonderful work. I'm gonna start from where Dr. Siddiqui has ended, and you answered by citing the stakeholders. Like, I know that the stakeholders is becoming a cliche word in many of the fields where we say we're gonna involve stakeholders. Can you think of the main key stakeholders that ought to be approached in the field of mental health, and especially postpartum mental health?
Highly esteemed opponent, thank you very much for your kind words and for your very interesting question. I think several stakeholders could play a very important role when it comes to addressing postpartum mental health, specifically in the UAE. One of the main, the first stakeholder, which I think that the mothers repeatedly mentioned in our study, is the gynecologist, and this is specifically in the focus group study. It's very important to involve gynecologists because they are the first contact point after childbirth with the mother, specifically during postpartum visit, because apparently that the mothers, they already have expectations from a gynecologist, and also perhaps to understand from these health gynecologists their perceptions and beliefs and attitudes towards their role when it comes to postpartum mental health, because I think that in the UAE, postpartum mental health perhaps is not, whether in identification or in treatment or referral system, it's not taken as a part of the gynecologist role, although it is expected from the mothers after childbirth. I would also include another stakeholder, which is the policy makers, to help them know more about the postpartum mental health problem in the UAE, and for them to advocate more for the funding for mental health resources and services. A third stakeholder that I would also involve specifically when it comes to expatriate mothers in the UAE is the husband support, is the husband. So it's very important to, since also this is something that is very much expected from the mother, to involve the husband in the intervention, in the planning, and for them also to understand their role in helping the mothers when it comes to their postpartum mental health.
Thank you. I'm going to take you a bit to your chapter 2. And again, a point was raised, and you answered it with Dr. Siddiqui about the possibility of a self-report and a self-selection bias that could have occurred in your studies. Could you kindly explain how would that have affected the main outcome, which I understand is the prevalence of mental health, and how, in a different word, you would have conducted the study to avoid it, to avoid that particular bias?
Avoid selection bias?
Self-selection, the self-selection bias or self-report, self-selection bias. How did it affect your results? And how would you have done it differently to prevent it or minimize it at least?
Okay, so in terms of how it could have affected our result, I think as we also have seen that there was some kind of decrease in the prevalence of the postpartum depression throughout the postpartum period, and immediately after childbirth, at 3 months and at 6 months postpartum. So again, as the mother perhaps they know that they've been followed up to see their postpartum depression, let's say, score. Perhaps they have sought to improve their practices or coping mechanism, and perhaps it could have led to decrease, or it could be also vice versa. The mothers would love to express more, and might have also led for the mothers perhaps to think that they have developed depressive symptoms. So how I would have targeted selection bias is the first thing is to make sure that I would have diversified more the sample, and to try as much as we can to recruit mothers also from further different settings, to make sure that this wouldn't have been like a barrier, or it could have influenced negatively our outcomes.
Thank you. Taking you again to the prospective study that you have presented, I'd like to, I was very interested to see the prospective nature of the study. I saw that you analyzed your prospective study cross-sectionally, which is quite interesting to look at the different time points separately. Have you thought of looking at the results in a prospective manner, building on the strength of your design, of your study design?
Could you please rephrase your question?
Like, I was very interested to see whether mothers who exhibited depressive symptoms at T1 also are the mothers who expressed different, did they improve over time? Do mothers who were not exhibiting any depressive symptoms in the beginning develop later? So I was very interested to see the strength of your prospective design analyzed. Are you interested in that aspect? Are you planning to look at it further?
Thank you very much for your question. And I think this is a very important and very interesting question that, in fact, to receive further insights when it comes to the change in postpartum depression symptoms, it's very important to look closer, for example, to see if the mothers who had a higher postpartum depression score, perhaps it has decreased or it's maintained, or vice versa, those who had a lower postpartum depression score had increased over the postpartum period. This is why we also suggested to further explore postpartum depression at different stages, even more than 6 months postpartum. This is something that we haven't done, but definitely we are looking forward to do in future research, because it's interesting and it could give us further insights, perhaps for also tailoring interventions in the future for postpartum mothers.
Wonderful, wonderful. A last question, if the time allows, is how are you planning to disseminate your findings? I mean, I know that the very good publications that you have put out in good journals, but are you planning to disseminate? I mean, these are extremely important findings, especially in the context. Are you planning to disseminate them in a different way?
Can you give a short answer?
Okay, so yes, definitely I'm planning to further do that through first collaborating with different researchers in the country in different across different emirates, so perhaps to widen make it bigger, like a larger study, because this is one of the main targets, especially with different healthcare authorities. And also we've been already doing that through conferences and through seminars and workshops to try as much as we can to deliver and communicate our findings.
Thank you very much. Thank you, Candid.
Thank you very much, Professor Nadia. Then the next opponent is Dr. Bruinsma, Assistant Professor at the Department of Health Promotion at Maastricht University.
Yes, thank you, Pro-Rector. Congratulations, dear candidate, with the very remarkable work that you reported in the thesis that was approved. And in that congratulations, I also want to include, of course, the supervisory team. You've been using quite a wide variety of research designs, surveys, focus groups, meta-analysis, which in my opinion really allowed you to triangulate the findings and obtain a very good understanding into the experiences of women in the postpartum phase, but also to give some directions on the role of digital interventions in trying to tackle and prevent depression. But I'm not fully convinced yet that the postpartum phase is actually the most appropriate in terms of timing. You show also in chapter 2 and 3, and you discussed also in the presentation, that the prevalence of postpartum depression is actually quite high. So shouldn't we intervene much earlier? And could you maybe elaborate a bit on why you chose specifically to focus on that postpartum phase instead of earlier preventive measures?
Thank you, esteemed opponent, for your kind words and for your questions. This is actually a very important question and a very interesting one. It's indeed very important to look to prevent postpartum depression, to target mothers even during the antenatal period, and even recent studies are focusing on prenatal, like even before we start planning, to have some awareness on postpartum mental health, so we can early identify any postpartum mental health problem. But the reason why we focus solely on postpartum is just because it was an overview study, exploratory, just to narrow our scope of work. But this doesn't necessarily mean that we should neglect the antenatal phase and even the prenatal, and to increase awareness on postpartum mental health. Now, to move to the second part of the question, when it comes to the technology-based intervention to target only postpartum mental health, I would say if the timing is the right timing, it depends on different factors. The first thing, if we want, let's say, to provide a technology-based intervention that covers postpartum mental health, I would say it could also cover antenatal, but it has to be more like a personalized technology-based intervention to provide the right information for the mother that would assist them, whether through their, because the factors that could influence the mother mental health during a pregnancy would be different than during the postpartum period, although some of them would also continue, specifically when we speak about socioeconomic factors. But so it could be more of a personalized. And another thing that if we want to speak about the right time for the technology-based intervention, if it's for postpartum after childbirth, I would say if it was in synergy with the usual care, then it would be at the right time. If there is some kind of follow-up with the available usual care, and again, not like a separate technology intervention alone. So if it's in synergy, there have some, it has some kind of follow-up from the healthcare providers integrated within the overall postpartum care, it definitely could be providing some, it could be useful for the mothers.
Yeah. Okay, thank you very much. You took away a bit of my concerns about this. It's not that black and white. So, and you also mentioned tailoring and that it should be in sync with already existing care. And that's a nice bridge to my second question. And before I ask it, I want to ask one of your paranymphs to read out proposition number 8.
Interventions should be designed and implemented with, not for, the target community.
Yeah, thank you very much. I fully agree with this proposition, but I do have a question about it, because I'm not fully convinced here that the mothers are the only end users. And as you also mentioned in your answer to my previous question, it has to be in sync with usual care, meaning that a lot of care professionals or also adopters, implementers, and maintainers. And you didn't weigh in their perception in the dissertation, but I can imagine that you spoke with healthcare professionals along the way of doing your research. So maybe you can shed some light on their perspective. Are they open towards such a digital intervention in the, during the pregnancy phase and the postpartum phase?
This is actually a very interesting question as well. I haven't spoken directly with healthcare providers when it comes to postpartum mental health, but this is something that I'm definitely very interested to do in the future, to actually take into account their perception when it comes to their role on supporting the mother's postpartum mental health, because previous studies have also mentioned that healthcare providers usually do not expect themselves to be involved in identifying postpartum mental health, or because they think that they don't have sufficient time. So, but generally speaking, when it comes to any telemedicine intervention in the UAE, there's actually increased adoption by healthcare providers. So I think this is a good opportunity, even if it's for postpartum mothers.
Yeah, I think my time is running out, but maybe we can continue the discussion later on. Yeah. Thank you very much.
Thank you.
Yeah, thank you very much, Dr. Bruinsma. Indeed, your time was running out. The next opponent is Dr. Van Haren, Senior Researcher at Zuid Midwifery Academy. The floor is yours.
Thank you, Pro-Rector. Dear candidate, I would also like to congratulate you and your supervisors on your solid and very important piece of work. You should be proud of the result. As a midwife, I recognize the importance of raising awareness about the mental health of mothers worldwide. After all, a good mental well-being helps women to be resilient and face life challenges. It contributes to a good and healthy start for both mother and child, with a positive impact on the whole family. Fortunately, there is increasing attention to this topic, but we still have a way to go. I have a question about Chapter 5, a focus group study about perceived mental health experiences and needs of postpartum mothers. And in your dissertation, you mentioned the sensitive nature of mental health issues and the stigma around it in public. Why did you choose for a focus group method? Would individual interviews not have been a more appropriate approach because of the sensitive topic? Also in the light of possible language restrictions, as the chosen language was English all the women were offered the possibility to answer in Arabic. However, they didn't.
Thank you, esteemed opponent, for your kind words and for your question. The reason why we chose focus group study and not interview-based, because I believe that it allowed the mothers to further open up more about the problem, about postpartum mental health. And during the discussions, as we were discussing the problem, we felt some sense that every time a mother mentions like some new thing that could affect her mental health, like which is something that usually occurs in focus group study, like it just motivates other mothers to further express their concerns. So this is the first reason, is to further understand and how the nature of a focus group study would support further the mothers in expressing themselves. And we tried as much as we can to build the rapport with the mothers, to try to let them know why we are conducting this study and that everything will stay confidential. So we made sure to do that before we start the discussion group, which I think that it allowed them to further express themselves openly, and the questions were very non-leading. There was no judgmental nature in the focus group discussion. Now, in terms of the language barrier, the reason why it was between English and Arabic, because English is the most commonly used language in the UAE, despite the differences in the nationalities in the country, but it was much easier for us to communicate, but we offered the possibility, as you mentioned, that if you have any concern, if you feel that you'd better express yourself in Arabic, just go ahead and do so. But I also definitely agree with the fact that there are some mothers from other countries who were underrepresented in our sample, that perhaps if they, for example, mothers who from South Asia, perhaps the way they would have expressed it would have been different, and it's much easier in their language, mother tongue language. But it was only 2 mothers who were already very fluent in English, and it wasn't a problem in our discussions.
Okay, thank you. That wonders. I'm figuring out. There was a good vibe in the focus group study. Do you think they will see it like a kind of peer support, like a kind of group consultation, talking with each other? Because you're focusing on individual interventions, like technology-based interventions. But if I read your dissertation, there is also, they need peer support. They need each other to talk about their problems.
This is 100% how it went, actually. And this is what the mothers, they actually mentioned at the end of the discussion group, that they felt that it was a therapy for them, that they found the place to just let out of every concern. Some of them spoke about their husbands, others spoke about other triggers that they felt that they needed to speak about. So definitely it was some sort of peer support for them, which perhaps have let them express themselves freely in our discussions.
Maybe that's something for the future.
Yeah, definitely.
Group consultations. I have one question. Continuity of care provider contributes to quality of care and positive experiences. You mention all kind of care providers like pediatricians, gynecologists, lactation consultants. That sounds to me that care is a little bit fragmented during the antenatal period and postpartum period. I'm a midwife, so I'm very curious, what role can midwives play in the United Arab Emirates during pregnancy, childbirth, and the postpartum period, as midwives can provide comprehensive care from a holistic approach and focusing not only on medical aspects, but just also on emotional and social aspects of giving birth.
Indeed, the role of a midwife is very important, but the reason why it wasn't mentioned in our research is because it's not commonly practiced in our healthcare system, specifically in the postpartum care. So the expectations are usually from gynecologists, from the pediatrician. So that's why, but it doesn't mean that the midwife doesn't have an important role. Definitely, if we further emphasize this in the provision of postpartum care, it would help the mother, as you mentioned, mentioned, not only in mental health, but also like the emotional aspect, the social, and as well as the role in breastfeeding and supporting the mother's breastfeeding journey, which has been a main challenge for them. And one of the participants have already sought for a paid service with a midwife in the UAE in order to receive the lactation support from through visits, home visits. So definitely the midwife plays an important role, and I think that it would have a very important role as part of the postpartum care.
Okay, thank you.
Thank you.
I'll give the word back to the Prorector.
Thank you very much, Dr. Van Haren. Then we come to the last opponent. It's Dr. Van Os, Assistant Professor at the Department of Health Promotion of Maastricht University.
Thank you. Dear candidates, I too would like to express my admiration for the meticulous work you've presented today as well as in your dissertation. And I think your understanding of postpartum depression, particularly within the unique cultural context that you have sketched so correctly of the UAE, is very impressive. You've clearly illustrated the challenges that are faced by these women in this region, and you've demonstrated a deep knowledge of the complex interplay between cultural, social, and economic factors contributing to the mental health problem. And I was particularly impressed by the strength of your discussion as you synthesized the findings very, very broadly and address a lot of the questions that many of us raised today as well. And I would also like to extend my compliments to your supervisory team for guiding this important work. That said, I would also like to ask a few questions. Starting with your findings on risk factors for postpartum depression, mainly chapter 2. When reading that chapter, where you discuss the prevalence as well as the risk factors, one may conclude that the majority of the factors that were related to the development of postpartum depression in your group of interest seem deeply anchored in the couples and the women's social economic position. Factors such as employment status, income management, housing were all main correlates. And although such socioeconomic factors are indeed important risk factors of many health problems, not only postpartum depression, they are notoriously complex and very difficult to target, of course, in preventive interventions. So I was therefore wondering why you chose to address particularly this elaborate list of factors reported on in Table 1. And you seem to have left out more changeable socio-cognitive or lifestyle-related factors, such as individuals' coping mechanisms, their diet, physical exercise, sleeping patterns, stress management, all kinds of these factors, as they might be relevant for screening purposes, but as well as for preventive purposes. I would like to hear your thoughts on that.
Thank you, esteemed opponent, for your kind words and for your question. Indeed, as you mentioned, we have targeted several potential risk factors for postpartum depression, but also this was one of the limitations of our study, that there are other factors, modifiable factors, that we have also looked into, which is actually one of the study objectives for us in the future. One of it is nutrition and the physical activity that also starts from pregnancy, that perhaps could prevent also postpartum depression after childbirth. So definitely, just because we have looked into these factors doesn't necessarily mean that we have covered it all, because other factors also include, which I would have loved to look into further, explore these factors, is the biological factors, or we're speaking also, I mentioned that the intimate partner violence, which also is very related to increased risk for postpartum depression. There are so many aspects, it's a very multifactorial condition.
But you're looking into that in your future endeavors,
definitely.
all right? Good to hear that, at least. Secondly, I was particularly interested in one of the more modifiable risk factors, mainly partner support, husband support. And maybe I overlooked it, but I was interested to hear how this was actually measured and what we should take away from the data on partner support in chapters 2 and 3, because there seems to be a big discrepancy between the two. In the second chapter, I think there was 2% of the women that indicated that they did not experience partner support. And in the third chapter, it was, I think, 36%, 36%, something like that. Could you elaborate on that a bit?
So when it comes to the partner support, it was measured with a simple question: did you receive sufficient husband support? But we do believe, and this is also another study that we're aiming to do in the near future, is to actually look further into what do we mean by husband support, by partner support. There are several aspects. Is it the informational support, instrumental support, emotional support, using a validated tool that we are currently validating it in the UAE to explore how it is actually associated with the risk factor. And I would also imagine doing further this with the mixed methods to also understand from the mother through a qualitative approach their perception of in depth of husband support. Now, the potential discrepancy between chapter 2 and chapter 3, I would say it's due to the sample size differences between both of them, and especially the limitations that we had during COVID-19 pandemic, that we were not able to reach to like a wide targeted population. So yes.
So yes, you indicate indeed in chapter 3 that women reported an increase in partner support during the COVID-19 pandemic due to lockdowns, remote working, but that data then seems kind of contradictory because they indicated less partner support.
During the COVID-19 pandemic,
yes,
they did it.
In chapter 2, you indicated that 2% only of the women only experienced no partner support, and in the third chapter it was 36%. So there was kind of an increase of the lack of partner support.
There was an increase during the COVID-19 pandemic, and I think this is, logically speaking, is which also occurred with us with several factors, aspects in our life when it comes to the isolation and the lockdown restrictions, so that the mothers perhaps have bonded more with the husband, they have expressed themselves more, the husband would have more time because he is more available at home, that provided more partner support for the mother during the COVID-19 pandemic.
Mm-hmm. Mm-hmm. Yes, it's a difficult synthesis. All right. Am I allowed to continue? No. That's it. Thank you very much.
Thank you.
Nivine Hanach, the time appointed for defending your thesis has passed. The degree committee will now withdraw to discuss the quality of your thesis and your defense. I request that you and your company await the results of our deliberations and our return in this room.
Thank you.
The PhD defense has now ended. The degree committee will debate the candidate's performance behind closed doors. This process usually takes about 10 minutes.
Southside, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and die. All your time, 'cause I'll go the extra mile. Long road to the south side, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and die. On the dash, got my laces tied. Long road, I don't waste no time. Break rules because fate decides. With the team and we chase the light. I make a move, fall down, shake it off. I hate to lose, bad branch, break it off. No room for negativity, praise and love. Prepare for deep part cause we're taking off. Hit the mileage, traveling so far from home. Gathering knowledge, other connections. I put the time in to get everything I ever hoped for. It's a challenge and we all in. It's a better future that we go for. Even though these nights seem long, I know that I am never on my own. Know you won the battle once you've grown. South side, 10 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and not. Long road to the south side. 10 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and not. Years can't fly by now, don't waste all your time. 'Cause I'll go the extra mile.
Nivine Hanach, the degree committee here present has assessed the quality of your thesis and your defense. In view of its positive verdict and taking into account your previous qualifications, the degree committee has decided to grant you the degree of doctor. Your supervisor, Dr. Hadja, if I can say so, is authorized to confer upon you this academic distinction in accordance with Dutch university custom. I invite your co-supervisor to now take the floor.
Please all rise. Thank you, dear protector. Okay, Nivine, do you promise to work in accordance with the principles of scientific integrity at all times, to be careful and honest, transparent, independent, and responsible?
I promise.
By the authority vested in us, by law, and in conformity with the decision of the committee here present, I hereby confirm upon you, Nivine Hanach, the degree of doctor, and grant you all rights attached by custom and law. As evidence of this, I now present you with the degree certificate signed by the rector, the secretary, and the other members of the committee, and affixed with the official seal of the university.
So, Kim?
For Kim, yeah.
You can start with the laudation.
Okay, I have dear distinguished colleagues, opponents, projector, members of the committee. Nivine, you did it. The PhD journey is complete, and it's my honor to deliver this laudation on behalf of your supervisor, Professor Nan, we are all greatly missed today. I want to congratulate you and your family on this incredible achievement. I'm thrilled to stand here today to celebrate Nivine Hanach's success. Her journey to earning PhD isn't just about academic excellence, it's about strength, resilience, and determination. Over the past 5 years, Nivine, you faced significant life challenges. You lived through the pandemic far from home, got married, and welcomed a beautiful daughter, Zoe, into the world, all while you were pursuing your PhD. Balancing the roles of wife, mother, and PhD candidate is no easy task. You handle it with grace, courage, and determination. From the beginning, your passion for maternal and child health has shone through your research, which focused on critical public health issue, maternal mental health. You've shed light on the status of postpartum depression among women in UAE, addressing their challenges and raising awareness about maternal mental health. This is an essential contribution, especially in UAE and the MENA region, where it can help reduce the stigma and spark cultural changes. Your work ethics, your dedication, your curiosity have been evident throughout your research. What's even more impressive is that you didn't just meet the basic thesis requirements, you exceeded them. While many PhD students struggle to publish enough papers, you've managed to publish 3 from your thesis in high-impact journals using a range of methods, including epidemiology, systematic reviews, and focus groups. You've submitted also 2 papers which are under review from your thesis. Your work has the potential to make a big impact, particularly in maternal mental health in UAE. It opens up crucial conversation about the need to screen postpartum women and increase awareness of maternal mental health in the community and healthcare system. Nivine, you are a self-driven, talented researcher with excellent writing and communication skills. You've shown great strength in balancing all your responsibilities. And I'm sure your family, your parents, your dear husband, who's with us here, were of great support to you, and especially your daughter, Zoe, will be immensely proud of you. As we celebrate your achievement today, we know this is just the beginning of an exciting new chapter. We're confident you will continue to contribute to your field and balance your many roles with passion and dedication. I would like to thank all the opponents for their effort and time. Your contribution is well appreciated. And I will close with a line that Professor Nani always says to you. I'm so proud of you, Nivine. Thank you all. Congratulations.
Thank you. Thank you very much. I don't know what to say, actually.
You don't have to say anything yet. You can do that later during the reception. Dear Dr. Hanach, also on behalf of Maastricht University, I would like to congratulate you with the degree you have acquired. Of course, it's a pity that your supervisor, Professor de Vries, couldn't be here. But he must be proud of you, the way you defended your thesis very well and very enthusiastic also. I'd like to congratulate your supervisors with this nice result. And I'd like to thank the members of the committee for the time they invested in preparing for this defense. And I especially like to thank the two opponents from the United Arab Emirates, Professor Sadiq and Professor Naja. Thank you for attending this PhD ceremony online. It's a pity you couldn't come here, but this is a nice replacement anyway, and for the candidate it's also nice to have some people from the home country. I think we appreciate it very much that you yourself came to Maastricht to defend your thesis. It's always very nice that we can do it live instead of everything online. So thank you for that. For you, it must have been very special that you became a mother during your PhD studies on a topic related to postpartum depression. I hope you knew how to not get depressed. You had sufficient support, and you were able to finish your PhD in quite a short time. So congratulations with that. Yeah, I think we have now come to an end of this academic ceremony. I close this academic session, and now it's time to relax, to enjoy the fact that you have obtained the PhD doctorate. We will make some pictures here and then on the staircase as well. And after that, we just enjoy.
Thank you very much.